My fellow Guyanese, the situation in Guyana with regard to the management of the spread of COVID-19 is dire and worsening by the day. There continues to be an alarming increase in the number of confirmed COVID-19 cases, which have now surpassed 25,000, and the COVID death toll is now at 641. New infections are at an all-time high. There were 215 new infections within the past 24 hours. Region 4 has accounted for 122 of the new cases. These numbers, though terrifying, may mask the actual numbers of persons who have not been tested. There is genuine fear and concern that the situation may be far worse than is being officially reported. There is a sudden increase in the number of persons in the intensive care unit. 33 patients are fighting for their lives in the ICU at the Infectious Disease Hospital at Liliendal, which you will recall was established by the APNU-AFC coalition government. We have also seen cluster spread as well as community spread of the COVID-19. From the available data, this is especially prevalent in our hinterland communities. My fellow Guyanese, we have learned as well that the gazetted measures have resulted in our senior citizens being refused access to the post offices to receive their monthly pension, on which they heavily depend. This will cause serious frustrations and hardships upon them. We are concerned too that the rushed reopening of school will expose children to contracting COVID-19, and they can further spread the virus to the vulnerable members of their households, particularly senior citizens. The Delta variant has proven to be formidable, even to the vaccinated. This Delta variant seems to be the predominant variant of concern, owing to how it is easily transmitted. Social mixing and movement and the relaxation of the measures will aid in the transaction and transmission of Delta variant rather than curb it. The situation urgently necessitates a preventive task force to address the inequalities and inequities in healthcare delivery. The PPP regime must also take into consideration the social factors which worsen the situation. These include increasing economic hardships, persons being unemployed, poverty, and homelessness. These are adversely affecting access to and effective delivery of healthcare. We in the APNU-AFC coalition continue to reiterate that vaccines provide a powerful and effective public health tool to prevent serious infections, hospitalizations, and deaths. We restate that the PPP regime must ensure that vaccines are accessible to every Guyanese. We strongly recommend that there be more testing for COVID-19, not only with the PCR test, which can give false positives, but also with the use of the rapid antigen test. On behalf of the healthcare workers, we appeal to the regime to provide more and adequate personal protective equipment, PPE, to our frontline workers who are in dire need of these given widespread shortages throughout the country. The coalition further recommends that the primary care and family medicine physicians be able to offer pre-hospital COVID-19 care to patients to help with early detection and treatment. We propose that steps be taken also to incentivize Guyanese to get vaccinated rather than to seek to make them poor and poorer. The APNU-AFC coalition strongly recommends that the regime steps up the public education campaign for the Guyanese citizens. We decry the casual approach to addressing the uncertainty, rumors, and misinformation surrounding the vaccines. Finally, my fellow Guyanese, the APNU AFC coalition strongly recommends that vaccination be voluntary and with informed consent. Coercion is not an option and is not science. Neither is fear-mongering science. We believe that vaccination alone is not the solution to contain the Delta variant, but a holistic approach is required to protect our people. We call on all citizens to properly wear masks, maintain social distancing, to wash your hands with soap and water, to avoid crowded spaces, and if you must stay indoors, ensure that your room is adequately ventilated, and practice healthy eating and the use of supplements. Let us all do our part to help curb COVID-19. Long live the people of Guyana. I thank you.